Amy, you're going to talk to us about home health.
Yes.
Please do.
Okay.
I too have recognized multiple things I need to change in my life, so I age gracefully. And also, now, thank you very much, I'm hungry. So I wanted to talk to you a little bit about home health care services. I've been working in home care for 13 years, so I know a little bit about it. There's a couple different kinds of home care that you can receive, and there's different ways to pay for home care. And some home cares don't take certain payments and other home cares do. So we'll kind of talk a little bit about the difference. I'll start with what Lakeview Medical Center home care is kind of like, and I think probably Mayo home care is also like this, that they're Medicare certified. And so, so home care is care received in your home for usually healthcare purposes. And Lakeview Medical Center and Mayo both provide Medicare certified home care services, which means that your Medicare will pay for it if there's a skilled need for the home care agency to be in your home and you are homebound, which means you can't get out of your home to receive the services elsewhere, meaning at the clinic or at a hospital or things like that. Anybody who has Medicare could receive this service if they qualify by being homebound and having a skilled need in their home. So what does that kind of look like? The easiest example to think about is somebody who has a new hip. Before they got the new hip, they were kind of trudging along with their walker and stuff. It was painful, but they could get out of their house and they could maybe drive, or maybe they had a spouse that could take them somewhere. And so they could go out and they could get their healthcare services outside of their home. But now they've had their hip surgery, so they've got this big incision, and their wife can't get them in and out of the car anymore because she is worried about hurting that hip. She's not strong enough to get him in and out of the car. And so they're pretty much stuck at home. They can't leave, and they need some physical therapy, some occupational therapy maybe, or some nursing services to come help them in their home so that they can get back to the way they were before. And so that's getting back to independence is what is usually the goal of home care services. And so that's what your home care agency is going to and should be working towards, is making you independent again and getting you off of services or discharging from that home care service as soon as possible. So the care is provided inside your home, and typically a nurse comes to the home for the first visit and does a head-to-toe assessment, and there's some fancy things like OASIS that Medicare requires that home care agency to do. And it's like a whole bunch of questions that the nurse has to answer to make sure that you're appropriate for home care services. You decide together with the home care agency what kinds of services you want, but also the doctor says, I think this patient needs a nurse and an occupational therapist and a physical therapist. And incidentally, I don't think they can take a bath either, so maybe you could send a home health aide to take care of them as well and help them get in and out of the shower. Or they can't shower anymore, but they need help taking a sponge bath. So there's different things that can be provided in your home to help you get you independent again while you recover from surgery. Another reason why somebody might need a Medicare certified program like Mayo's home care and our home care would be after a hospitalization for, say, congestive heart failure. So you're at home and you become short of breath and something's not right, so you end up in the hospital and the doctor says, you've got congestive heart failure and you've got 5 new medications that you have to take, and you're going to be on oxygen for a little bit of time, and it's going to take you a while to get rid of all that swelling that's now in your legs and your feet, and you're kind of on a rough road here, but we can get you there, and we're going to teach you about your disease and help you on the road to recovery so that you can live with this long-term illness that you now have. So they might also order home care for something like that. So the nurse would come into the home and provide skilled care, which would include education on congestive heart failure, maybe teaching you about all of your new medications. Maybe you took your medications from a bottle before, so now you need a pill box to set them up in, and you've never done that before. for. So the nurse will teach you how to set your pills up in a box. Physical therapist can come out and help you with exercises and how to move around in your house with that big long oxygen tube that's trailing behind you that feels like a tail now. Occupational therapy can help you, teach you how to put like stockings on your feet and things like that. So that's kind of skilled home care, usually paid for by Medicare as long as you're homebound and you have a skilled reason to have it in your home. Other kinds of home care provide more custodial care. And when I say custodial, that means I need help getting my groceries, I need help taking a bath, I need somebody to wash my dishes for me. Those are more what we call custodial care. And there are different kinds of agencies that provide that. One that I can think of off the top of my head is Visiting Angels. Heidi's Hands-On in Home Care is another agency. Can you think of others? Helping Hands. So there are some agencies out there that would use maybe private money from you. You would pay for them privately, or maybe you have private insurance, or you have some long-term care insurance that might pay for something like that, and you would work that out with your long-term care to help pay for custodial care in your home. In the cases of custodial care, there's not a requirement usually that you have to be homebound, just that there's a need for the service and you're willing to pay for it. So that's what home care is. Anything something I missed? Do you guys have questions about home care? I see a couple people nodding, like maybe I've had it before, or I understand it, or I've had to deal with that for a loved one. The payers, Medicare, Medicaid, private insurance, and long-term care insurance. So.
I was just going to mention one thing. With the home care, the custodial care that you just said, they also help if, say, your spouse or your loved one had Alzheimer's disease or dementia and you needed like a break so you could come into town and do groceries or somebody to sit with your loved one so that they were safe.
Yeah.
It's another reason they're calling us all the time.
Yeah. I think the ADRC is a great resource if you're looking for somebody to come into your home, because sometimes maybe you don't want an agency, but I think they have lists of people who like to do those kinds of things and have been kind of checked and like, here's a good resource for you for somebody who could help provide some care in your home, and a list of what that person might be able to do. So there's skilled care and unskilled care that you can receive inside your home if your goal is to stay in your home. We also contract through the VA as well. So the VA does not require patients to be homebound to receive our home care and your home care agency's services. You don't do VA? No, but we do contract through the VA. So sometimes the VA will call us up and say, hey, this veteran, he's just struggling and he needs help with his meds, or he needs a bath, but he still goes out and does all these other things, but we want to pay for his services, and so we will accept VA benefits for that patient. Okay, you only have the skilled, so Mayo only has the skilled services. Okay. There's also, I mentioned nurses, occupational therapy, so I don't know if you guys know the difference between occupational therapy and physical therapy. So physical therapy, I like to think, makes you like bigger and stronger and tougher, and helps you kind of get from here to there. And occupational therapy makes sure you're dressed when you get there. And then we also have speech therapy. Speech therapy deals with not just how do I talk, but how do I swallow. They also deal with brain health. So all of that kind of stuff you know, brain health, speech therapists deal with that all the time. So it's not just the mechanism of swallowing that speech takes care of, or how do I talk after a stroke. It's how do I talk, swallow, and how does my brain remember to do all of that. So home health aides, and then we also have a social worker that can help with things like that. So incidentally, I just want to mention speech therapy. One day I got to watch the whole mechanism from a swallow study perspective, where you get to see the person swallow. And there are so many things that happen at the same time when you swallow. It's amazing that we all don't walk around with like because it's unreal. So that's all I have for home care. Okay.